This is my audience. Oh. What is congestive heart failure? Congestive heart failure is a disease of the heart in which the heart fails to pump sufficient blood as well as oxygen to the rest of the body. The causes of congestive heart failure can be hereditary, or it can be caused from lack of sufficient diet, as well as bacterial infections that affect the heart. It could also be caused by a heart attack in which the heart muscle is completely damaged. It is very often that when a patient has a heart attack, that one side of the heart is damaged, not the whole heart as a whole. In those events, a patient may undergo surgery in which a defibrillator is placed, which can cause the heart to restart in the event that the heart does stop pumping completely. So the defibrillator actually restarts the heart and will put it back in its natural rhythm. Complications of congestive heart failure include swelling of the limbs, swelling of the abdomen, swelling of the face, as well as fluid retention in the abdomen. In the event that fluid is built up around the heart or in the abdomen, the patient can undergo a procedure which is called thoracentesis or paracentesis, in which the physician will go in and draw out multiple amounts of fluid. They'll take a long needle and stick it into the belly and withdraw whatever fluid is invading that cavity. Some symptoms of congestive heart failure include shortness of breath, swelling of the limbs, which I've already stated, fatigue. They will also include lethargy. Patient will often have, like I said before, abdominal swelling. They'll have yellowing of the skin. In the event that the patient has got excessive fluid, it will put strain on the kidneys, which can also lead to kidney failure. In patients with kidney failure, they'll often have to undergo dialysis, which takes the actual strength off of, or the weaknesses off the lungs and off of the kidneys and causes them to function better. It helps reduce that fluid. If a patient is not capable of having dialysis, they will give the patient Lasix that will help reduce that water retention. The only side effect of the dialysis is it puts an extreme amount of stress on the heart, which can cause the heart more damage. It can cause the patient to go into acute respiratory failure and cause the heart to actually stop. There is really no treatment for congestive heart failure. The only thing they can do is have quality of life measurements. It is usually not reversible. It may be chronic or it can be acute. Patients who have acute onset of congestive heart failure are typically more at risk for things such as further myocardial infarction as well as fluid retention. The patients who have the chronic congestive heart failure are really more apt to having more severe symptoms because it is an ongoing thing. In those patients, they need to be more aware of what they're eating. They need to watch their diet strictly as far as their sodium intake goes. They need to make sure they exercise. If they smoke, they need to quit smoking because that smoking is what actually is putting the strain on the heart because of the lack of oxygen. If the body's not getting enough oxygen normally, then adding that smoking factor is reducing the oxygen level, making it more difficult for the patient to breathe. The prognosis for a patient with congestive heart failure is really, they are not expected to die soon. They can live anywhere from 20 to 50 more years. Just really depends on the extent of the congestive heart failure. Therefore, it's not a death sentence. It can be maintained as long as the patient understands that their lifestyle does need to change. They need to quit drinking if they drink. They need to quit smoking. If they do smoke and they don't want to quit, then they definitely need to reduce their smoking intake. Their quality of life is typically poor. Those patients who have congestive heart failure typically eat bad. It is known that it is hereditary, but it's not always hereditary. Your lifestyle choices play a major role in the heart disease itself. They want you to monitor your cholesterol. Typically, patients with congestive heart failure have high cholesterol because of their diet. The fried foods, the unhealthy eating habits, potato chips, things like that are just really not healthy. You can prevent congestive heart failure in the cases where it's not hereditary. If you have high cholesterol, see your doctor. Make sure your doctor is aware that it is hereditary and they can medicate you to make sure that you keep your cholesterol levels at a reasonable rate. Again, exercise. Exercise is the key factor. Make sure you're exercising and you're keeping your heart at its full, capable, functioning part. You really want to keep your heart healthy. Make sure you're getting the oxygen levels that you need. If you know anybody with congestive heart failure or who is at high risk for congestive heart failure, make sure they see their doctor, make sure they keep up with it, and that they take their medication like they're supposed to, especially in patients who have other diseases such as diabetes or high blood pressure. Those things are risk factors for congestive heart failure. So again, if you have family members or friends who are at risk, please keep up with them and make sure that they do see their doctors normally. And again, if they do have congestive heart failure, keep an eye on them daily. Make sure they're doing what they're supposed to, because it can be fatal, although it is not a life sentence, like I said. Thank you.